So your goat has diarrhea. Suddenly that cute backyard companion becomes a walking mess. It's unpleasant, stressful, and probably has you frantically searching the internet for answers. But here's the good news. Diarrhea in goats isn't always an emergency, it's a symptom. And once you understand what's causing it, you can act fast, fix it, and prevent it from coming back. In this guide, we're breaking down everything: the causes of diarrhea, what to feed a goat with scours, and how to treat it safely and effectively. Diarrhea, or scours, doesn't mean your goat is sick with a specific disease. It means something is wrong inside their digestive system. The real challenge is identifying what triggered it. There are several potential causes, each with different solutions. Let's take a closer look. One of the most common causes of diarrhea in young bottle-fed goats is overfeeding. Whether you're using milk replacer or raw goat's milk, feeding too much or feeding too often overwhelms the kid's digestion. The result? Sour-smelling, yellow or white diarrhea. To fix this, reduce the milk volume per feeding and ensure there are consistent gaps between feedings. Never let young kids nurse freely unless under close guidance. Goats are sensitive to diet changes. Shifting suddenly from grass hay to alfalfa or introducing grains too quickly can throw off their rumen balance. This kind of diet shock often results in loose stool or greenish scours. Always introduce new feeds gradually over 7 to 10 days. This includes fresh greens, grains, or switching hay types. In early spring, fresh grass is lush and full of moisture. While goats love it, their stomachs may not. If they've been on dry hay all winter, rushing them onto green pasture can cause sudden diarrhea. Let them graze in short intervals at first, about an hour a day, and increase slowly to allow their rumen time to adapt. Stress can absolutely trigger scours. Transporting goats, moving pens, bad weather, or introducing new herd members are all stressful events. If your goat is still active, eating and alert, monitor for a day before giving medications. Often they recover with rest, water, and calm surroundings. Coccidiosis is a serious parasitic infection common in kids aged 3 weeks to 5 months. It's caused by protozoa, not worms, and spreads through dirty bedding, shared water, and poor sanitation. Always act quickly as coccidia multiplies fast. In adult goats, diarrhea may point to a heavy parasite load, particularly barber pole worms. Look for other signs like weight loss, pale gums, bottle jaw, and reduced appetite. A fecal test is the best diagnostic tool, but if unavailable, you may begin targeted deworming with options like valbacin, ivermectin, or cydectin, depending on your goat's condition and local resistance patterns. If your goat develops sudden bloody diarrhea and collapses or dies quickly, it could be enterotoxemia, a toxin-producing infection usually caused by overeating grain or rich feed. What to feed a goat with diarrhea? Once you've identified the likely cause, proper feeding becomes essential to recovery. Feed only dry grass hay. Avoid alfalfa, grains, kitchen scraps, or rich treats. Offer fresh, clean water at all times and add electrolytes to help replace lost minerals. You can also offer plain yogurt or goat-specific probiotic paste to help rebalance gut flora. At this stage, time is critical. Contact a vet immediately. Begin fluid therapy, either orally or subcutaneously if trained, and administer medications based on symptoms and age. Electrolytes and supportive care can make the difference between recovery and rapid decline. Fecal testing saves time and lives. If you raise goats, invest in fecal testing. Whether through your vet or by learning to do it yourself, knowing whether you're dealing with coccidia, worms, or something else will help you treat correctly the first time. If this video helped you, hit that like button, subscribe for more goat care videos, and turn on notifications so you never miss a critical update. We're covering everything from natural parasite control.